Welcome back to Radio Entrepreneurs. I'm Jonathan Freedman, and our next guest in the virtual studio is Maria Burke, owner of Celtic Angels Home Healthcare. Welcome to Radio Entrepreneurs, Maria.
Oh, hi, Jonathan. It's so nice to meet you, and it's an honor and a privilege to be on your entrepreneur radio show.
Well, it's a pleasure to have you. We're all about entrepreneurs here and bringing guests on and learning more about your story and experience as an entrepreneur. So, why don't you tell us a little bit about yourself and a little bit about how you got started with Celtic Angels Home Healthcare?
Absolutely. Well, in case
I'm
you
going to jump in
didn't,
and say I know where the name came from.
you do? Oh my God. I know. Well,
Yeah, yeah.
that's a story within itself where I came up with that name. But I'll just start a little bit in case you don't recognize the accent. I'm originally from Ireland, even though I have been asked if I'm from Russia because I used to speak so fast when I first came to this country. Nobody understood a word I said. So I'm the oldest of six and a typical Catholic Irish family. And I think my caregiving journey started when I was about 8 years old, and my grandfather worked in a hospital in Ireland, and he was called an orderly. And in Ireland, we have men to do all the heavy lifting. And he used to take me over there with him to the hospital, no private rooms. We'd have like all the beds lined up. And when he wasn't working, he played the accordion. So he'd
Hmm.
bring me over and he'd go up and down the aisle playing the accordion. And I suppose I can remember looking at the patients, their faces, and it was kind of they were in this very kind of dark place, and it was just all of a sudden they lit up and looked like different people. So I would say that was the start. When I originally came to Boston, I wasn't a nurse in Ireland, but I had a near death experience which I wrote about, and the course of my whole life changed after that. So I ended up in Laborie College, fantastic college. They train you so well. I was so prepared, and I got my RN. So I worked in Boston Medical for a while. Then I did visiting nurse, and it was while I was working as a visiting nurse, I just noticed that a lot of the caregivers in the home care setting didn't really have the supports that they needed through no faults of their own. So I started to think about starting my own home healthcare company, and it was a very scary thought, and I felt like I was jumping off a cliff. And I'm sure that all the entrepreneurs out there can relate to that because I really did have a great job, and I loved what I did. But
No, it's fabulous. You were in a career that is obviously a very noble profession and one that, as we've learned over the last couple of years, takes the brunt of things, front line, so to speak, and a very difficult and demanding occupation. But then you took that and looked to transition into becoming an entrepreneur, which you've got to have. A stomach of steel to be able to last as an entrepreneur and a nurse. So tell us about the home healthcare business and why you thought that that was an opportunity and what you saw as some of the challenges that you wanted to address.
I think I just love taking care of people, and hospice work is such a privilege to be able to help people to pass at home. So in 2005, I started Celtic Angels with at my kitchen table, and so my mission was very simple to give patients, care, exceptional care at home, but also to take care of all the caregivers, nurses that are providing this care, because as we know, caregiver burnout is a very real thing at the moment. And I don't know if any of our listeners have ever had the opportunity to go into a nursing home, but honestly, there's no place like home. Um, that's where people really want to be. That's where I want to be. I don't want to be anywhere else. And I started very simply providing home health aid and certified nursing assistants that were helping the patients, take care of their activities of daily living. But the key ingredient that I thought was missing from a lot of healthcare agencies was like the nursing oversight. And that's what I could bring to the table. So all of our patients are case managed by a nurse.
It's
So
fascinating you say that because it seems as though in an industry that is, at least from the outside, would seem to be so highly regulated, really at the point of care is not highly regulated because you can't have eyes on what's going on in somebody's home, correct?
exactly, exactly. And there's such a huge trend now in home care. People are, they want to be discharged from hospitals earlier. They do not want to go to rehab. They want to have their rehab at home. So there's a big shift in the industry. And honestly, between what's happening in our healthcare fields right now, hospitals are overwhelmed, staffing shortages. I mean, you definitely can get the best care at home if you have the right people in place to take care of you.
So, Maria, given that you've been doing this for quite some time and you've gone through a global pandemic, the missing ingredient that you felt not only the quality of care for your end user, your patient population, but tending to your staff and their needs.
Yes.
What were you hearing, and given that I think the public's awareness has been increased around the challenges faced by people in the healthcare profession. But what were you hearing that were some of the common complaints that led to burnout or led to people leaving the profession? And how did you combat them? I guess would be
Yeah.
the follow-up.
Okay. So I think that with the staffing, like a lot of people work 12-hour shifts. And sometimes, if it's a very intense, if it's a very medically complex patient, or for our nurses in the hospital that maybe have 5 or 6 medically complex patients, at the end of 12 hours, they don't have anybody to take over. Now they have to do extra hours, what's called mandatory overtime. It's a real challenge because they're totally exhausted. So in Celtic Angels, we're very mindful of how we schedule our coverage. And we work individually with everybody's schedule because honestly, truly, we all need to have like a healthy work-life balance. And I feel that's what's kind of and I get it. It's very challenging. We have a nursing shortage right now. We're going to have a doctor shortage. So it's very, very challenging. But I think that contributes so much to caregiver burnout. And actually, I'm just starting a virtual reality training, and it's directed to caregiver burnout directly. And how can we, like, as a country, solve this problem because it affects every single one of us today?
Absolutely. I mean, it is such a pervasive issue that, to your point, it's frustrating because we don't seem to have the organizations or the resources. We limit size of medical school classes. We limit size. Nursing programs are going away,
Yes,
and as a country, we don't necessarily push the medical field at an early age. For some of the reasons that you got into it. The rewarding aspects of caring for people and especially vulnerable populations. And many people, it sounds like in your care focus, end of life situations where they want the dignity and people to provide that. Yet there doesn't seem to be any of that goes on. I mean, I'm not aware of any kids in high school that learn about nursing as a career and an
right.
opportunity. And
Yes.
yet, this is as the population ages, to your point, it's only going to become a larger issue.
I know, and it's kind of scary because I think by 2030, I think it's going to be the first time in our like history that there's going to be more senior people than younger people,
I already feel
which
that way. Actually,
you
I feel
do.
like I'm part of that. I look around and everyone seems younger. And that kind of happens overnight too.
Yeah,
Um,
I
so
hear you. I hear you. It's aging is not for the faint of heart, but we have to
that's for
console
certain.
ourselves.
So
Even Madonna
Maria,
goes through it.
uh, maybe maybe a little close to home, but I wanted to ask you this question because of your experience, where there is a shortage of staffing and a pandemic has brought about challenges. how have you and your firm, and I'm going to make a presumption here that you've been able to keep people
Yes,
for a prolonged period of time, and you have some longevity amongst your staff.
yes,
What do you attribute that to? The mindfulness around scheduling, the
yes,
listening to people. Do you spend a lot
yes.
of your time interacting with your staff?
I do. I have an open door policy, and we just respect and care for our caregivers, and there's nothing we wouldn't do for them as long as it's legal, shall we say. So because they do face the whole, well, like we have a lot of single moms, we have a lot of caregivers that are actually in college training to be nurses, social workers, which is absolutely amazing. Like I say to them, well, you are the heart of Celtic Angels, and all of us in the office are your pulse, the support staff, which I
Hmm.
truly, you know, I truly, I'm sorry. I just get emotional talking about it because there's they are Celtic angels.
No,
So
really is incredible work that you're doing. Nice to see that you've been able to, I hope, weather the storm, so to speak, and
yes,
continue to prosper in your business. If people want to learn more about Celtic Angels, if they want to speak with you directly, if they are interested in the services that you provide, what's the best way for them to reach out to you?
sure. Well, you can go on our website and we have a host of videos, blogs, and the website is www.celtic, which is spelled with a C, CELTIC, angelsinc.com. Or you're welcome to give us a call anytime at 781-331-0062. And my direct email, which if I can ever help anybody, we get a lot of donated medical equipment that we gladly give away. My direct email is maria@celticangelsinc.com. Please feel free to email me anything that we can do to help you.
Wonderful having you on Radio Entrepreneurs, hearing a little bit about your story. Maria Burke, owner of Celtic Angels Home Healthcare. It's been a pleasure having you on Radio Entrepreneurs, and I had to hear you say it so that I can understand the correct pronunciation. As we like to say, I'm Canadian. As I like to say, the original pronunciation of the word, which has become Celtic in this country.
Yes, yes,
So,
yes. That's
our
all
guest
right,
is
Jonathan. You're all set. No problem. You're from Canada. I forgive you.
exactly. Wonderful having you on. Our guest on Radio Entrepreneurs has been Maria Burke, once again, owner of Celtic Angels Home Healthcare, and we will be right back with another segment on Radio Entrepreneurs.